So we've spoken so much about Tetralogy of Fallot, and I just felt like we needed a video where it is specifically addressing, the possible causes. Like, what are the things that could actually cause Tetralogy of Fallot? All right. So what are the things that could actually cause Tetralogy of Fallot? So what we have here, this is Tetralogy of Fallot. I think this image will be better for you, where all the major defects in Tetralogy of Fallot are explained. Number one, pulmonary stenosis. So blood is not able to flow into the pulmonary trunk very well again. Number two, right ventricular hypertrophy. So the right ventricle is doing the most of the work, so it is becoming thicker. Just like if I'm lifting iron in the gym, my biceps will become thicker. All right. You have overriding aorta. Okay, that's number three. Then four, there is like what, an opening between the ventricles, so blood is flowing in and out. Okay, and it's not supposed to be like that. So what could be the possible causes? What could make this issue come in? So first of all, you should know that it's a congenital defect, arises during fetal development. So the exact cause is not really known. Most of the times you can't really pinpoint one thing. Do you understand? But you can do some guesswork and blame some things. So we said that genetic and chromosomal factors. So sometimes there's usually what, Down syndrome, okay, DiGeorge syndrome. Sometimes it's just a family history. Like, it just runs in several people in the family, but they haven't actually pinpointed the gene that usually has that problem. You understand? Then moving forward, the maternal risk. Sometimes it's coming in because the woman is approaching menopause. So if somebody is approaching menopause, when they have when they conceive at that time, there's a whole lot of risks to the child. That one is a story for another day. Then sometimes it's maternal infections. So infections like rubella can interfere with how the heart is developing. Sometimes it could be that the mother is abusing alcohol, taking a whole lot of alcohol. Maybe the mother is using drugs. Maybe the mother is smoking. So all of that could actually lead to some effects on the baby. The nutritional deficiencies. So lack of essential nutrients like folic acid can affect fetal organ formation. The environmental influences, exposure to toxins. So the mother has been exposed to all those chemicals, pollutants, medication use. So some drugs used during pregnancy, maybe for the good of the mother, but they actually have some one or two side effects that could affect the baby. Okay, so that's it.